Why do you still have lower back pain when you've possibly seen a therapist or a variety of therapists, you've had different therapies, it's continued over a period of time and it's still not going away? Well, that's what we're going to discuss in this tutorial. I've tried to break it up into different sections because I want to try and turn it into sort of talking through the journey. So what we're going to talk about first is the first step to overcoming lower back pain. Then we're going to look at what you can do yourself. What does then a professional do if you look to get professional help, or what should they be doing? We're going to talk about MRI scans and how they fit into the equation. And then we're going to look at the overall sort of journey of overcoming lower back pain, because it's a lot different to what people think it is. So we need to try and sort of make that very clear. So once we've got that clarity of the journey that we're on, it's much easier then to go through and sort of walk through that journey. First of all, what I want to do is just to quickly explain who I am. If you haven't watched any of my videos before, my name is Chris. I run a company called Christopher Hall Training, a personal trainer and a sports massage therapist. I'm also an exercise for low back pain specialist, so I've done a variety of qualifications. One of them being trained by Dr. McGill and his team over in Holland for the McGill level 1, 2 and 3. So I have that expertise as well. So I work with a variety of the general public, not only in fitness but also working with injuries. So I can see the perspective from a fitness professional, but I can also see the perspective from a therapist's perspective, being a sports massage therapist myself. So what we are first of all going to talk about, and what I should say I guess before we start, is I've got some basic notes and basic prompts up on the screen there. So if you see me looking in that direction, that's what I'm looking at, because I want to try and stay on track. I know I can tend to go off on tangents, but I want to try and stay on point as we go through this. So what's the first step to overcoming lower back pain? Well, it all comes down to the most fundamental part of it, which is understanding lower back pain, or at least having a better understanding of lower back pain. This will sort of be highlighted and talked about a little bit more when it comes to the final question, which is what's the journey? But essentially, the better we can understand the lower back pain, the better we are able to then go about treating it. And it generally, well, I say it generally comes down to a consultation and an assessment first off. Now, this doesn't mean that this is going to bring out all of the information in one shot. We fully understand the lower back pain and it's then going to be cured, you know, the next day. What we're looking to do with this consultation and assessment is gain a better understanding of it. What will then happen is, as we then start understanding the lower back pain better, we'll then start putting in better solutions and treatments about ways of overcoming it. What we will then do is gain feedback on that, and then we will then readdress the advice, the recommendations, the exercises, the stretches, or whatever it is that we're putting in place to overcome that lower back pain. So we start with a verbal consultation. So we start listening to what the individual is saying, asking them very specific questions about movements, postures, positions, loads, pain triggers, pain patterns, pain-free triggers, pain-free patterns. So all this is just gathering information and fact-finding and trying to understand the lower back pain. Because if we can start understanding that, we get a much better idea of where we are. A lot of the time I describe talking about like a car journey. We need to know 3 things to be able to fulfill the car journey that we're on. We need to know where we are, we need to know where we're going, and we then can then plot the route to get from where we are to where we want to be. That's exactly what I'm doing with this consultation and assessment. Is we want to know, or we know where we're going, we want to be pain-free. But what we need to also know is where we are, because that's what helps us plot our route from where we are to where we want to be. So these questions, these physical assessments, that's exactly what they're doing. They're helping us understand where we are so we can then plot the route. Now, as we go on that route, it's then going to be a case of gaining feedback. Are we moving towards where we want to be? If we are, great, we'll keep going. If we're not, then we need to readdress that. All of that will come out as we start working through the process. And that's, in a sense, what most people need to really think about first, is understanding the lower back pain, to figure out what are their pain patterns, what are their pain-free patterns, and we come on to the next question of what can you be doing yourself? Well, on a very basic level, you can take action right now. You can start understanding your back pain a little bit better right now, so you can then start putting in immediate solutions to that. And that is by just simply asking your questions. What postures, positions, movements or loads make your pain worse? That, in a sense, is what I'm trying to figure out. I've got a bunch of different questions. I've got an initial questionnaire that I get people to fill out, and I've also got like a pre-formatted consultation that I take people through. But I'm always adding in supplementary questions based on what the person's telling me, because they'll take me on little sort of mini journeys to find out certain information as well. So it's asking yourself what postures, positions, movements and loads make your pain worse. That will help you start to figure out what triggers you need to think about and the stuff that you need to start reducing, avoiding, or at least adapting. What you've then got is the exact same question: what postures, positions, movements or loads make your pain, or make your pain better, so help you become pain-free. If you could start identifying those two different sort of parallels, if you will, you can start to find things to avoid and things to start doing. It is the beginning of understanding your lower back pain and finding that pattern within your lower back pain. So it's a very simple sort of basic start that you need. That can then help you, start chipping away at your lower back pain. Once you then start to get to that point, what you'll then find is you may get some progress, but then you'll get to a point where progress starts to slow down. What we then need to do is sort of go through the questioning again. We then need to start thinking about what are the next steps onto that. And this is where, in some respects, a trained professional should be coming in. Not only can we start the journey, but we can carry it on as well, because we should have the expertise, the skills, the knowledge to be able to get you to that point. So some of the things that we should be doing is we should be able to identify through your answers to through the answers to our questions where the pain's coming from. So we can start to think, well, this is a flexion-based pain or an extension-based pain. It's coming from a vertebrae, or it's coming from a vertebral disc, or it's coming from a nerve, or it's coming from muscles in the hip, things like that. We should be able to start to identify that. So a lot of what we can do can just move the journey along a lot quicker. If you decide to do it yourself, then there are things that you can do, but the journey will just be a little bit slower. We can accelerate that because what we should have is the knowledge, the expertise and the skills to be able to move you through, to identify where you are a little bit quicker. So for example, I had one gentleman, and I suppose I could use two examples. They're complete opposites. One had or exaggerated his pain when he was sitting. The other person, his was relieved when he was sitting. So we've got two different, in a sense, examples there. So let's talk about the one, it was when he was sitting. So what we need to do with him is we need to try and get his sitting duration longer, because it was a part of his work. But what he did have the ability to do was stand and lie down and work. So he could use those three different postures, sitting, standing and lying, to be able to work. So it's just a case of modifying that. And what he was basically finding is that the less he sat, the more he was able to sit. It's a bit of a paradox, but when he was working, so he was using different postures whilst he was working. So he was standing at his desk, he was sat at his desk, and then he had the ability to lie down and still work from his computer as well. So the more he did that, the longer he was then able to sit for any one period of time. So that might be just watching the TV, that might be sat at his desk as well, or it might just be like sat on the bus or something like that. So the more he was able to do those three things and sort of interval between them, the longer he was able to walk. So that was a strategy that we found. Obviously that then came through in the questionnaire, it came through in the assessment, and it came through in the consultation. So we were able to do that. We were able to move him through. He was able to extend how long he could sit, which was making his work life a lot easier to manage. The person where sitting relieved it, obviously we can't always use that. So if we identify that that makes it better, we can't always use that because we have to move around. So what we had to be able to do was, sitting was a strategy that we used. And it was very much a case of, we needed to use it as rest breaks. But obviously when he was watching TV, when he was working, things like that, that was obviously helpful. But when he would get up, that was when the pain would exacerbate. So what we then had to do was that the movement part of it, we had to manage that. So we had to find strategies in a way that we could sit him down, get pain-free. We could then get him up and still be pain-free. So that took some certain exercises, some certain stretches, and some certain different bits of like self-massage and therapy. So we were able to do that, so we could then start moving around. So he got to the point where, or he started off where he could only walk around for 30 seconds before he got pain. We then implemented some exercises, stretches, and sort of self-therapy in the form of like self-massage with foam rolling and things like that. So he could then walk around for 3 minutes at a time. So what we then were able to do was we used 3 minutes of movement, intervals with like a sitting and a rest break, or at least finding a resting posture which was pain-free. So we were doing that. So then we were able to get it up to 7 and 8 minutes. So he could then start going out again, walking for a prolonged period of time, because he was, in some respects, he was kind of housebound because he couldn't walk very far. What we were then able to do is get him out doing that. But that's an example of what a professional can bring to the table and what a professional should be bringing to the table. What they should also be doing is that we should be finding those postures, positions, movements, loads that can reduce that pain, because we're trying to find patterns in that. What we get a lot of with therapists is they've got a special technique, or they've got a special massage, or they've got a special method that they use, and it can get you out of pain. Therapies are able to do that. I'm a sports massage therapist myself. I understand that. I can get someone out of pain. I can send them on their way. But what I do know is that for the most part, that's just treating the symptom rather than the cause, which is what we're going to talk about later on. So what we also have to be able to do is manage that journey that we're sending people on. We're looking for patterns we're looking for pain patterns, and we're looking for pain-free patterns. So it's very much thinking about what those patterns are, and then starting to put strategies in place, as I mentioned in those examples with the people walking. So again, you can sort of, if you need to sort of think back to those, but you can use those as metaphors, or you can take the principles away from it to be able to start overcoming your lower back pain by just thinking in the same way. What is triggering your pain? What is making your pain better, or what is helping you become more pain-free? You could start there. Then you can start thinking about what are the strategies that you could put into place. Now, obviously, I can't talk about specific exercises and I can't talk about specific stretches because I don't know your specific nature to your lower back pain. So that's going to be harder. That would require consultation, self-assessment, so on and so forth. But what you need to understand is that lower back pain is leaving you clues. You just need to be able to interpret them. So that, again, that's very much, you can learn how to interpret those. You can then learn how to put the strategies in place. Obviously, it takes time, and a trained therapist or professional can help speed that process up, because in some respects they'll kind of know that journey. But we have to go through that consultation and self-assessment to be able to understand the specific nature to your low back pain, so we can tailor the solution to that. So what about MRI scans? A lot of people think they need an MRI scan, and they are a useful tool, but they're not always 100% necessary. If we are gaining progress with someone's lower back pain, it's getting better, I don't necessarily see the essential need to go and get an MRI scan if we're making progress with it. If we've identified that pain is coming from flexion-based pain, it's just a case of avoiding those flexion postures. Now, if there was like an inconclusive type of assessment of the lower back pain, then the MRI scan can serve as a useful tool to be able to get some conclusive objectivity on that. So an example of that is working with someone that, and this is a real life example, someone that I've been seeing, he had lower back pain, and then all of a sudden it disappeared. And then we continued working, and then all of a sudden, pop, it came back again. And then the second time, it hasn't gone away. So the first time that I saw him, and I was working on it, and we were putting in strategies in place, and it was getting better. So he was able to reduce his pain because we understood that. He was able to relieve his pain when he needed to, because again, we understood that. And then all of a sudden it went. So I had my ideas of where I thought the pain was coming from and what that was telling me. And I knew he had a history of lower back pain. So that was in my mind as well. So we treated that and helped overcome that. Then it came back. Now this was the point in which it was like, well, okay, that then starts to make me think there's more significance in the history of lower back pain. So that was a point at which, well, I think it's now a good idea to go and get an MRI scan. I could have gone to do that straight away, but because we were making progress, it wasn't necessarily an essential thing to do because we were making progress with it. So we then went back, we are sort of getting the MRI scan. So what that's then going to do, that's going to give us sort of more conclusive feedback, and it's going to help confirm or deny what I was thinking. Now, my suspicions are that it's going to confirm some certain things that I was already thinking anyway. Those are my suspicions. It may well not, but those are my suspicions. So it's then very much a case of continuing and putting that in place to be able to then overcome this lower back pain. But this is the process that we are now on. It is a process of understanding the lower back pain. It's not a case of going, you have lower back pain, I'm a massage therapist, I'm going to work on your muscles to get rid of your pain. And therefore, if the pain isn't going, it's not a problem with my service, it's a problem with your body. That's not necessarily the case. It's very much, it's understanding the lower back pain well enough to be able to say, right, this is the therapy that you need. This is the scan that you need to go for. So what we are trying to do is not pigeonhole someone into saying you need this therapy, or you need to have that exercise, or you need to go for that scan. It's very much thinking, right, okay, we need to make progress with this. We need to get you out of pain, because even if he was going for an MRI scan, it's going to take him a few weeks to get to that point. So we need to get him out of pain or reduce his pain up until that point as well. So it's very much thinking about it in that fashion, in so much that it's not an overnight solution. But just going back to the MRI scan, the other thing that we need to think about is that MRI scans can only pick up certain things. So if it was a sciatic pain, the MRI scan can pick up potentially the disc bulge, or a certain type of disc bulge that's pushing on the nerve that's creating the sciatic pain. But what it can't necessarily pick up on are the trigger points in the hip. or the piriformis syndrome that's happening in the hip. It can't necessarily pick that up. So the MRI scan could come back inconclusive because they're saying, well, there's nothing wrong with the spine, but you've still got the symptoms. So where else is it? So what it's doing is it's helping us identify, is there a problem with the disc? But if it's saying there's no problem with the disc, we have to go somewhere else. But then we could be thinking about, well, maybe there is a problem with the disc, it's just not showing up on the MRI scan. So there's all these different types of questions that we need to juggle with and that we need to investigate so we can get a better understanding of the lower back pain, so we can tailor and make the treatment that much more specific. So where I say MRI scans are a useful tool, they are there to help us investigate the lower back pain so we can understand it better and provide that more specific tailored treatment for the lower back pain. So it's very much, it's there to help us understand the story of that lower back pain, and it's going towards helping us understand that, which then leads us on to the next part, which I guess is the sort of final part, which is all about the journey of overcoming lower back pain. Now, I've been alluding to it in some respects all the way through this, in so much as it starts with understanding the lower back pain and then we go about investigating it, because there have been very few cases of lower back pain that I've treated that all of a sudden just disappear. There was one lady that I was working with, she had sciatic symptoms, but I'd identified, I think it was over a period of 8 weeks, and it wasn't necessarily a consultation over, over the 8 weeks, but we did a consultation, we started working on it, and then in the 8th week that we worked on it, I worked on a hip trigger point, and pop, it went. And then all of a sudden, she gets very, very mild instances of it, but she knows how to manage it and it goes away. Whereas before, it was a pretty constant chronic thing. So it wasn't necessarily a problem in the back, it wasn't necessarily a problem sort of in the piriformis, but it was a problem in the hip trigger point. But that was over an 8-week period, but that was one that literally disappeared in that moment, because for whatever reason I treated it, treated the trigger point, and there it went. That's one example. Now that's the minority, not the majority. The majority are very much it's a journey that someone's on, and we go through that process of understanding lower back pain. So it's not a case of, right, I need to go and see a therapist, they're going to treat me, they're going to solve my problem. It's very much taking yourself on a journey to think about a therapy as a tool to be used to help you achieve what you want to achieve. I guess the fundamental way of overcoming lower back pain is improving your movement, posture, position and loading of the lower back pain. I've mentioned those 4 things before, but as a general rule, it's those 4 that get you into the problems. Therapies can then assist you in getting into better postures, positions and helping you load, but they aren't necessarily the standalone sort of solution to it. Again, they are tools to be able to help you get there. So it's very much thinking that you're on a journey, and as I alluded to before, you're going to make progress, then you're going to plateau. Then you need to rethink where you are. You need to possibly go through some basic questioning. Okay, what's making it worse? What's making it better? And then again, start pushing those boundaries. Thinking about what exercises, stretches, movements, postures, positions, loading. Thinking about, is that taking you closer to where you want to be? So that's the journey that you're on. It's not, right, I'm going to go and see, I'm in pain, I'm going to go and see my therapist, they're going to get me out of pain, then in 2 weeks I'm going to be back in pain, and then I'm going to go and see them again. It's very much thinking, right, I'm going to use this as a tool, but what I've got to be doing is noticing how frequently I'm in pain, how intense the pain is, how regular that pain is. Once we can then start reducing that, using a therapy, we can improve the movements, postures, positions and loading of the lower back to be able to reduce that further and so it doesn't come back, because we're looking at treating the cause. And why do I say that movements, postures, positions and loads are the fundamental cause of lower back pain? Well, if we think about a disc injury, so a herniated or a bulging disc, a very common pattern of that is improper use of the spine. So flexing the spine and then having the spine flexed and loaded. That's slowly pushing the gelatinous fluid within the disc towards the end. Now that doesn't happen overnight. That doesn't happen with one movement. That happens over potentially many years of poor movement. So it wasn't the incidents where you went to pick up the pen from the floor and your back went. It wasn't that one incorrect lift. It was all the many incorrect lifts that happened before. So if we can improve the movement, we can reduce the stress and take it away from the spine, and we can then start to replace that with better movement, which will reduce the stress on the spine. It will spread the loads around the torso, and it will improve the health of the spine. And then we can start putting the building blocks in place using exercises and stretches to then start making your core more resilient and robust, stronger, more stable, so it then doesn't, or the pain doesn't happen as frequently. So it's understanding that journey, and it's understanding all the different steps that are taking you towards where you want to be, and understanding all the steps that are potentially going to take you away from where you want to be. And then if they take you away, how to get back on track. So I guess to summarize this discussion around lower back pain, so number one, the first step to overcoming lower back pain. So this is something you need to be doing with yourself or someone like me. Now, I'm going to put in the description the link that goes through to my remote or online lower back pain consultations, where you can do this exact thing with me. But basically what you need to be able to do is understand your lower back pain. Try to understand your pain patterns and try to understand your pain-free patterns, because that's going to give you a good clue to which direction you need to go, and it's going to give you a good clue as to the types of movements, postures, positions, loading, exercises and stretches that you need to be doing. So that's number one. That's the kind of thing that you need to be doing yourself, or you can get someone like myself to help you with that. Then we talk about MRI scans. Should we be getting them? Yes, they are a useful tool. Are they essential? No, they're not, because sometimes they can be quite inconclusive, but even if they are inconclusive, that helps paint a picture and tell a part of the story. So yes, they're useful, but they aren't necessarily essential. And what is the journey? Well, the journey is a process of investigation where we start moving towards pain-free. It will possibly then start to plateau, so we then need to reinvestigate to stretch that boundary again before it plateaus again, stretch the boundary again before it plateaus again. So that in some respects is the journey that we're on. It's not just a process where we go and see a therapist and then they get us out of pain and then we get back in pain 2 weeks later and we see a therapist again. That's a bit of a self-fulfilling prophecy. So many thanks for watching. Hopefully it's been helpful. Hopefully it's given you a better idea of some of the things to start thinking about when you're when you have lower back pain, and hopefully you can start putting in some solutions and treatments in place to overcome that. Again, if you need my help, the link is in the description. So many thanks for watching. My name is Chris from Chris Training. I will speak to you in a future video.